about the use of prompting when working with individuals with autism and the prompting hierarchy. First, let's talk about what is a prompt. So a prompt is any cue that assists an individual to emit the correct response or engage in the target behavior. This could be an instruction, a gesture, a demonstration, physical touch, really any cue that helps the patient engage in the correct behavior. And prompting is important to teach and increase independence with new skills. So if a patient is working on something brand new, they're obviously not going to know exactly how to engage in that behavior or to emit that correct response right away. So we'll need to use some levels of prompting to help teach them those skills. It also ensures patient success. Like I said, with a new behavior or a new skill, they're going to have to be taught how to engage in it. That's why we're here. That's why we're teaching them things. So using prompting is helpful in that. It also pairs desired behaviors with access to reinforcement. So if we're working on a new skill, it might be challenging. The patient's never engaged in that behavior before. And prompting helps them access reinforcement when engaging in this new skill. So it pairs that success with reinforcement. It also reduces patient frustration. If a patient is working on something brand new, it would be really easy to get frustrated, get discouraged. So using prompting helps reduce that frustration. When we talk about prompting, there's a hierarchy. So starting at the top of this visual is independent. That would be the least invasive level of prompting. And as we move down the visual, we're getting more and more and more invasive until we get down to the bottom, full physical prompting, which is the most invasive. And then if we're using most to least prompting, going from the most intrusive of a full physical, trying to fade down to independence, then we are becoming more independent. We are fading prompt levels, so we're going less invasive rather than more invasive in that case. Our first level of prompting is independence. So for an independent trial, you would provide no prompts to the patient. You would give them the instruction and then allow them the opportunity to respond or engage in the behavior by themselves with no additional cues. And here's an example of that.
Touch the cup.
So the patient was not provided any additional cues after that initial instruction. That's an independent prompt level. As you saw, she did error. She touched the pillow instead of the cup. So that tells us we need some level of prompting here. The patient does not know how to engage in the correct response yet, so let's teach her. The next level of prompting is called verbal prompting. So this is providing a verbal cue such as the beginning sound of the correct response or even the full words of the correct response to help them engage in that target behavior. Here is an example of this one.
What's your name? Pickle. What's your name? Mary. Mary. What's your name? Mary. Yeah, nice job. Yay.
So you saw in the initial trial, she said pickle, which is not her name. She was then provided with that verbal prompt of what's your name? Mary. Mary's the correct response. She was able to copy that verbal prompt and then engage in the target behavior by herself on the final trial using verbal prompting. The next level of prompting is called visual. So this is using a picture, photograph, video, or any other type of visual cue to indicate the correct response. A couple examples are visual schedules, which we see at the top here, an example of that. This is helpful for routines or longer skills like toothbrushing, things like that, that having a visual of step-by-step might be helpful to help the patient remember how to engage in that target response. Another example is like a visual field card or note card here where if we're working on tell me your phone number, rather than giving them the words to say, we could write the correct response on a note card or a piece of paper. So then we are asking the instruction and then holding up the visual rather than using words. We're using visuals there. And then a more subtle visual prompt would be something like we see here with the letters on the right. If we're working on listener responding, identifying the letter Q, we could circle it, highlight it, put a line under it, make it bigger, anything to make that correct response stand out from the rest of the options in order to indicate to the patient, hey, this is the correct response. This is what you're supposed to be selecting. Moving further in the prompting hierarchy is a gestural prompt. So this is pointing in the direction of the correct response. And you can see an example of that in this video.
Touch the cup. Touch the cup. Good job. Touch the cup. Yeah, nice job.
So we saw the patient errored, and then the instructor pointed to the cup on the next trial to indicate this is the cup, this is the one you should touch. And after that gestural prompt, the patient was able to engage in that correct response after the instructor pointed in the direction of the correct response with the gestural prompt. Getting even more intrusive is the model prompt. So this is actually performing the correct response. So the patient sees exactly what it's supposed to look like, and they can copy that behavior. Here is an example of a model prompt.
Pick up the cup. Pick up the cup. Pick up the cup. Yeah, nice job.
So the patient was shown exactly what it means when we say pick up the cup. The instructor showed her pick it up with your hand, lift it up in the air, and then following that model, the patient was able to engage in that behavior. Moving more intrusively on the prompting hierarchy is a partial physical prompt. So this is guiding the patient's elbow or guiding them by their forearm in the direction of the correct response. So we're not using hand over hand prompting. It's more of a subtle physical prompt towards the correct response, which you can see in this video.
Touch the cup. Touch the cup. Touch the cup. Yeah, nice job.
So as you can see, she was guided by the elbow for that partial physical prompt in order to engage in the correct behavior of touching the cup. The most intrusive prompting level is full physical. So this is at the bottom of the prompting hierarchy. This is using hand over hand prompting to move the patient's body all the way through to complete the correct response. And you can see an example of that here.
Touch the cup. Touch the cup. Yeah, nice job.
So the patient errored. She touched the plate instead of the cup. And then the instructor used hand over hand prompting. She picked up her hand and brought it all the way on to the top of the cup so that she could learn what that meant when you say touch the cup. To review our prompting hierarchy, the top independence is the least intrusive prompt level. That's allowing the patient to engage in the behavior by themselves without any additional cues. And if the patient is unable to do that, we then start working in some more invasive prompting levels. And as we go down this visual, it's getting more and more invasive until we get all the way to the bottom with physical prompting. And then with least to most prompting, we would start at the top of the hierarchy and work down, getting more invasive as we need to. And most to least prompting would be the opposite. So we're starting the most invasive as possible, so physical prompting, and then we're trying to fade out of those prompts to increase independence and work towards an independent response. Thank you so much for attending this training. Please let me know if there's any questions.